Myself, Fema Malini, MPT Ortho, Lecturer, Faculty of Physiotherapy, Dr.M.G.R. Education and Research Institute. Today I am going to discuss about suspension therapy. Suspension therapy is a thing in which we are going to suspend the part of the body or whole body with the support of slings, pulleys by using the suspension ropes. And there are three principles. According to the three principles, we will be giving the suspension therapy to the patients. The first principle is friction. Friction is nothing but it is a force that is exerting in between the two surfaces. That force will resist the movement of an object which is going to slide on the another object. Here, when the friction is less, the movement will be more slippery and it will be more smooth. And whenever the friction is more, that is particularly in the hard surfaces and in the rough surfaces, the movement will be restricted and the movement will be more slow. Here in the suspension therapy, we are going to use a principle of less friction. By using the principle of less friction, we are going to provide the smooth and easy movements to the patients. And the second one is pendulum. That is the second principle is pendulum. Pendulum is a thing that is commonly we call it as a heavy objects that is going to hang in the weightless ropes. Here what happens when we are giving some force to that pendulum, that heavy objects that is going to be hanged in the weightless ropes, there we will get the oscillatory movements. When complete sling, we call it as the oscillation. The speed of the oscillation steps down according to the resistance that is provided by the air and gravity. Here in the human body, according to the pendulum principle, the common example is our upper limb and lower limb. In our upper limb, the arm swings in the air against the gravity. It is one of the example. And in the lower limb, while we are walking, we will be getting the forward movement of the leg that is hanging on the air against the gravity. These two things is the best example for the pendulum in the lower limb. We are going to use this principle in the suspension therapy. Third principle is elimination of the gravity. Here, in case of suspension therapy, we will be using the grade 2 muscle power patients for the suspension therapy. That is the elimination of gravity. And if the grade is more than 3, it is better to use the other resisted therapeutic exercises rather than suspension therapy. Indications for suspension therapy, mainly in cases of spinal cord injuries, that too hemiplegia, paraplegia and quadriplegia cases, and in cases of post-operative cases in which we are going to improve the muscle power and to avoid the muscle atrophy. And the advantages of the suspension therapy is we can reduce the burden of the therapist and we can easily lift the limbs of the patients, and the active movements of the patients can be easily elevated in the early stages. And the benefits of suspension therapies, the four main benefits of suspension therapies are: we can maintain the property of the muscle, we can strengthen the muscle, and we can able to maintain the ROM of the particular patient. And the most important benefit is we can easily make the passive movements to the patients by reducing the therapist work. The instruments we are using in the suspension therapy are, first we are going to see about suspension frame. This we otherwise call it as the Guthrie-Smith's apparatus because he coined the term suspension therapy and he invented this procedure for the therapeutic purposes. And this we call it as the suspension frame. In the suspension frame, we will be having mesh. This mesh will be covered on the head side and on the foot side and also on the top. All other sides it will be opened. And it is made up of the stainless steel or plastic coated steel. This apparatus is made up of, and this apparatus length will be 2 mm, width 2 mm and breadth will be 2 mm. And on the top of the apparatus we will be having the cushiony material for the comfortabilization of the patient. And the second thing is the rope, suspension ropes. Suspension rope is made up of hemp material. In Tamil we call it as the sanal. There will be no use of any plastic materials or wiring materials. It is made up of, completely it is made up of the hemp. Here this wire we can divide the suspension rope into the three types, that is primary suspension rope, secondary suspension rope, and the vertical suspension rope. Primary suspension rope is used to make the suspension through the fulcrum, that is in the axial suspension to the distal joints, and the secondary suspension ropes are used to stabilize the proximal joint, and vertical suspension ropes is used to make a point over the mid of the joint in cases of suspension, that too particularly in cases of vertical suspensions. The third thing is wooden cleat. In this wooden cleat we will be having 3 holes. The suspension ropes are got inside to this rope and it is hanged to provide the suspension, and in case of providing the in case of changing the height and to provide the suspension, the wooden cleats should be placed in horizontal direction. In some cases, if we need to provide the resistance, in those cases we need to place the wooden cleat in the oblique direction to provide resistance to the particular suspending movements or particular oscillating movements. And the next thing is pulley. This is a pulley. It is mainly used to make the movement oscillation more easier for the patient in case of suspending the limbs on the suspension apparatus. And the fourth thing is the next one is sling. In sling we will be having 3 types of the sling. The first sling is single sling. In single sling we will be having the D-shaped hook on the 2 edges of the sling, which is used to hang the particular limb, especially your elbow, wrist, in those elbow, wrist in cases of suspension. This we call it as the single sling. This is the second type of sling. This we call it as the double sling, in which the slings will be on the both the edges of the slings we will be having the hooks. Apart from that, in one edge of the sling we will be having one hook, and on the sides of that to left and right we will be having another 2 hooks in the sling. This we call it as the double sling. It is used on the more weighter regions of our limbs, that is your thigh, your trunk. In those places we can use this double sling. Third one is, this is called it as the head sling. It is mostly used for the occipital region in the supine lying and for the accommodation of the ear on the lateral lying. And here we will be having 2 hooks on the edges of the sling and 1 hole for the accommodation of the ear in cases of side lying. This sling we call it as the head sling. And next thing is the S-hooks. We can use S-hooks or dog clips. This is called as the S-hooks. This hooks is to hold the slings to that mesh and to make the suspension movements, that is the oscillatory movements. Hi, today we are going to see about the upper limb suspension therapies. There are 3 types of suspension: axial suspension, vertical, and the pendular suspension. Axial suspension is a thing in which the suspension point should be on the joint axis and the body of the patient or the body of the human should be parallel to the surfaces, and the movement was initiated in case of axial suspension. The advantages of axial suspension is we can able to improve the range of motion, we can able to maintain the muscle property, and it is helpful to improve the muscle power. And then the vertical suspension. In vertical suspension, the suspension point should be center of the body or center of the gravity, that we call it as the R sacral S2. And now in this vertical suspension, mostly it is helpful for the relaxation of the body and to suspend her body in cases of immobilization or in cases of relaxations. And the third type is the in pendular suspension we can give resistance to the axial suspension, which helps to improve the muscle strength. For example, how we can give resistance means, if you are going to train the shoulder abduction, we can change the axis towards the adduction side, that is medial side, so it will have resistance to the abduction action, so we can able to strengthen the abductor muscles in the shoulder joint. So in upper limb suspension, first we are going to see about the shoulder joint suspensions. So first we are going to see about abduction and adduction of the shoulder joint. In abduction and adduction of the shoulder joint, the joint axis, that is suspension point. Okay. Today first we are going to see about shoulder joint suspension. In shoulder joint suspension, first we are going to see about abduction and adduction of the shoulder joint. First, the position of the patient should be supine lying, and the point of the suspension should be joint axis, that is particularly 1 inch below the acromion process. So the point of the axis, here we need to put one S hook. Here we need to put one S hook for the point of axis, and then we need to use two single sling. This is one single sling, this is another single sling. This single sling is used to stabilize the elbow joint, that is the proximal joint, and again this single sling is used to stabilize the wrist joint. It should be on the wrist joint to stabilize the distal joint, so that we can able to achieve pure movement on the shoulder joint alone. Then the supporting ropes and wooden cleats should be used to suspend this particular upper limb. So we need to put the D slings of the D hooks of the slings to the S hooks, and same as of in the primary supporting ropes and on the secondary supporting ropes. Then raise the wooden cleft. After putting in the proper position, that is the limb which we are going to make the suspension movement should be above the joint axis, so that only the suspending movement will be free to the particular patient. Now ask the patient to do the active shoulder abduction and adduction. Abduction and now adduction. It will be more free for the patient to do when you suspend the particular limb above the joint axis. Now we are going to demonstrate the shoulder flexion and extension. For shoulder flexion and extension, the position of the patient is side lying, and the point of the suspension is as it of the joint axis exactly over the greater tubercle. So we have to put one S hook straight to the greater tubercle, and then we have to put two single slings, one single sling to support the elbow joint and another single sling to support the wrist joint to achieve pure movement over the shoulder joint. Now we have to connect this single sling to the S hook to connect with the supporting ropes. Now we need to connect the D hooks of the single sling to the S hook to connect the sling with the supporting ropes. Now if we need to adjust any height using the wooden cleft, we can increase or decrease the suspending limb height. Now we can able to initiate the shoulder flexion and extension. Flex pannunga shoulder. This is the shoulder flexion. Extend your shoulder. This is the shoulder extension. We are going to see about medial and lateral rotation of the shoulder joint. Here the point of axis should be your olecranon process. So the S hook should be straight to the olecranon process, and you have to use one sling to stabilize the wrist joint, and it is connected to the axis by using the supporting ropes. And another thing, the shaft of the humerus is supported by one sling. It is connected by the hooks, and it is connected to the head mesh. And now here we are going to make medial and lateral rotation in the second order lever of the joint. Rotate the shoulder into medially. This is a medial rotation of the shoulder. Come to the neutral. Rotate the shoulder joint laterally. Yes, come back to neutral. This is medial and lateral rotation of the shoulder joint. Do medial and lateral rotation. We can make this medial and lateral rotation in sitting position too. Next we are going to see about the elbow joint. In elbow joint, elbow flexion and extension. Here the position of the patient is sitting and we need to ask the patient to flex the shoulder 90 degree and elbow in 90 degree. And now we need to keep the point of suspension as the lateral epicondyle of the humerus, and you have to make one hook on the point of suspension, and we need to use two double sling to stabilize the proximal shaft of the humerus and to stabilize the forearm bones, and we need to suspend these single slings to the ropes, and wooden cleft is used to adjust the height of the particular sling to make the limb suspended. And now we can ask the patient to do the elbow flexion and extension. Do elbow flexion and extension. Today we have seen about the upper limb suspension, especially on the shoulder joint and elbow joint. On the next session we will see about the lower limb suspensions. Thank you.